Firstly, introduce myself. My name is Russell Saad. Today, I will be co-hosting this webinar, and I would firstly like to greet in the warmest way Dr. Ghazwan and thank him for being here with us. It's really a privilege, Dr. Ghazwan. Thank you for being here. Today, you're going to give us a hint of your intelligence and experience in the medical and surgical field. Now, to give you all some background on Dr. Ghazwan, he is a board certified orthopedic surgeon with exceptional achievements. He has renowned his role as an orthopedic spine surgeon at Al Kindi Teaching Hospital in Baghdad. He leads as one of the chairpersons of the AOS Spine Iraq Council and is a prominent endoscoping spine surgeon trainer at the Max Morrow Spine and Endovision. He's also an active member of the esteemed medical societies including the Middle East Spine Society. He brings a lot of wealth and nourishment of knowledge into our community, and he has participated in over 110 conferences. So, thank you very much for being here once again. Before beginning, of course, I would like to kindly ask everyone to keep your microphones closed to not cause any type of distractions with the sounds. If anyone does have any questions, you may leave it into the chat. And once we get to the questions, we will call them out, and Dr. Ghazwan himself will be answering each of them. Thank you.
Thank you. First of all, I would like to thank you all being inviting me for this amazing talk, delivering my very simple, humble, short experience in orthopedic surgery, which is, I think, from my perspective, is thinking as out of the box, which is the way that I like it. First of all, I was working in let's say in Kindi private hospital, in Kindi teaching hospital before, but almost I'm planning to leave it for many reasons. I will discuss it later on. This is first of all, I would like to start with a take-home message that if you want the result, invest in progression. Whenever you see any guy who is expert in his field, try to dig in the process that he started before and how he started and then how he let's say overcome the obstacle and the limitation in his way. I'm a good fan of delivering a talk all over the world about limited resources country and surgeries, and I succeed in arranging many sessions in the worldwide conference. So I will pick up some of these slides today. Learning objective of my presentation will be why to be a doctor. Are you happy with your specialty, private or government? What's your plan, employee or CEO? How to choose your way, how to plan your goal, and the average will determine your next step or not, because this is a determined factor in our society. And how to get trained, how to build your CV, and some end up with some resources. As we let's say agreed that we will collect the question to be filtered by the admins. So please write your question whenever you feel, and we will try to answer it at the end of the talk. Who am I? I think that I delivered my CV, which is a busy CV if you compare it with the Iraqi surgeons, but this is the big asset that I have, that I started from 2004 with a simple Word file, and this file is stayed with me whenever I update it, and now it's about 26 pages, I think, and it will be more and more. I think that's the simple way that you know who am I. You can just review my CV. The first thing that's I am a doctor, so it's my business. Whenever we talk about the doctor, and before 2 days, that's I discussed with one of my relatives that we know that's الطب حالة إنسانية. So you are a doctor, so you have to be an إنساني. زين. فكان النقاش انه simply انت انسان فلازم تكون انساني، فمو شرط انه بس الطبيب انه يكون انساني، فكل مهنه انه لازم ان تكون انسانيه، من ضمنها الطب. سو يعني من انا اقول انا طبيب انا انساني from my perspective this mean nothing. That's why I choose this sentence that it's my business. First of all, you have to build your brand. This is my new logo and website, which is this is my third logo in my career. And second, it's called niche market. So if you want to be a successful surgeon, see this is one of the let's say busy street with many doctors labels. So whenever the patient come to this street, which surgeon or which doctor has to choose? Simple thing that I am always talking with my senior doctor and even my residents and other, try to find a niche market that's not available, that's make this the any patient choose you as a doctor. Simply let's say من يكون sorry that's يعني راح يكون mixing Arabic وانجلش يعني مرات العربي يكون شويه يعني اريح واسهل يعني، ويعني my English is not so good like you يعني. فالفكرة انه انت بتسأل نفسك سؤال، شنو اللي يخلي المريض اكس يسأل على دكتور غزوان؟ ليش دكتور غزوان؟ فمن تجاوب هذا السؤال then you will be a successful man. For me, it's not only endoscopic spine, but I feel that endoscopic spine is new in the market, and it's popular all over the world. So I choose it from 2018, and nowadays I'm doing most of my work as endoscopic spine. Third, look for a solid base. You know, my experience in the research started in 2015 when I was invited to one of the course about endoscope, and they asked me, that's what's your goal, what do you know about endoscopic about research? Unfortunately, we know nothing. And from that time, I start to invest in research, and nowadays I'm yeah, I'm too young to say that I'm good in the field of research. There are many guys, including you. I think that they are more active than me, but it's not easy to be a busy surgeon and working in the research. So these are my CV on ResearchGate and Google Scholar. Have a mentor. This is one of the critical points that I invested that started in 2000, let's say 10. These are some guys and mentors from all over the world that I met, and I have a very good connections with them. Some of them they are inventor of many techniques. That's including Daniel Rowe. This one, Alex Vaccaro, he has more than 300 publications. This is Antoniani. He's the inventor of the endoscopic spine. This is Kim, and all over the world. So having such mentor will have a great impact in your life and career. Before start, if you want to have such positive feedbacks, which is actually not sponsored, but it's a real feedback, and if you let's say you have to choose between private and government. As I told you, I started to invest in teaching and learning, attending courses since 2010, and proudly that these are all from my pockets, not sponsored by any company except one or two, three events, I think, in my life, to be honest. And the good thing that it's not sponsored by the government, because I'm not a good guy from the government base that's to be nominated for one of the courses outside. So the tip and tricks between government and the private, this is summarized in this slide. So from my perspective, I think that's a private. I own my time. I can cancel any list or any, let's say, clinic time to go everywhere. I have on my life, because it's not uneasy to have your life, although it's a risky, because at the end of the day you will end up without let's say monthly salary, so you have to invest your time. But this is, for me, is a positive point. You have your time, as we mentioned. You can select the time of the clinic, the time of the surgery. It's need very good, very hard effort, and lots of money to invest. And you have to think about competition, because working in a private is not an easy job. On the other hand, government is, you are at the end, you are employee, risk free. It's ongoing process. So at the end, you will have, let's say, your career 20, 30 years. At the end, you will be retired, and you will have a pennies of Iraqi dinar, that's not less than, let's say, 700, 800 at the end of your life. No extra effort, because at the end, if you do more, you will face a problem more. So you will be, let's say, you will have more problem. No competition at the end. And the environment, you can't imagine that. If you compare in Iraq, the private from the government theaters, hospitals, and I think you have all the data. So all of us thinking about such luxury car and this luxury watch, and traveling to Vegas, and also buying some diamond to our wives. So I think, from my perspective, that this cannot be done in private, in government hospital, although some guys, they are doing that. The second thing, that's, am I happy with my specialties? Proudly to say yes. And if the time returning back, I will choose again and again orthopedic surgeon. And my answer is not far away from what's written in the data, because the data show that 97% of the orthopedic surgeon, they are choose their specialty again. And the unhappy guys, they are the internal and family medicine. So think about it, and choose your specialty in the right way. Employee or CEO, as I told you, if you are planning to work as employee, so please leave the webinars, because the next coming slides are talking about how to be a CEO, and how to be your boss in your clinic or your hospital. So the structure that we have to have in order to build, let's say, an CEO, or be a good guy in a private, have to have a golden infrastructure, having a smart goal, invest in yourself, don't be rush, having a mentor, as I mentioned before, surround yourself with a positive. So these are the diagram that show the surgical specialties in the first row. These are the private owned physician, and these are the employee physician. See how much the difference between the income between both of them. So again, if you want to invest in choosing the specialty, think about this. If you are going to be an employee, thinking about right side, psychiatry, family practice, emergency medicine, they own more in a government hospital, while the surgical based, gynae, internal medicine, subspecialties, and other, they earn more in the private market. This is a very important, because I saw that's your reply on the form, that most of you, they are choosing between surgical and medical, although some of you, they didn't choose of yet. So I think that this diagram will give you a hint about choosing the right specialties. How to choose your way, because as you know, some of you are graduated, and his or her brain, they are full with idea and question to be answered. I think that's when I was in my fourth, let's say, secondary school, I'm always saying that I will be a cardiac surgeon. I don't know why, actually, but that's mean that I choose to be a doctor from that time. And when I was in the medical school, I choose the way, the specialty being orthopedic. Although some of you, they didn't choose yet, as I mentioned, as I saw your data, that's not good. That's not too bad, actually, because you can start it simply by writing a draft plan, searching for resources, asking your senior guys, see the conditions about, let's say, call, working hours, let's say, how much he can gain. because even in orthopedic specialty, there are some guys they didn't earn more, not they didn't earn more than their government salary, which is not more than let's say 1,000, let's say 1.5 million to 3 million as a maximum. So being an orthopedic surgeon not always mean that you will be, let's say, the guy who can travel free and buying a Rolls Royce car and the other. By the way, I don't like cars, so all the picture that you saw here, they are mine except the Rolls Royce. So you have to apply it in your life. So whenever I want to be, let's say, internal medicine, so is it fit for me? So how can I start my career? And the other, test your feeling. This is a very important. Let's say, keep your time and invest your time in going to one of the hospital and doing, let's say, in the ward to see what the other do. So is this specialty is fit for me? Then after that, open your eyes and start your journey. This is what I did, and I recommend you that's how to choose. Although there are many factors that include your average in the medical school, family, husbands, wife, where you are living, and many other factors. So second point, that's plan your goal. So whenever, let's say, okay, I will be an orthopedic surgeon, that's it. But you have to set your goal according to the SMART criteria. And I know that some of you, they know what does it mean, and it's applied in all of our life, not only in orthopedic surgeon. So this goal should be specific, measurable, attainable, relevant, and time bound. Another point, you have to be a self-discipline. This is a very important term that I learned actually from my last 3 or 4 years, because we always say that I cannot do this because I don't have real environment or suitable environment. I don't have time. Let's say I'm living away from the city. I'm not able to travel because I don't have money, and many excuses. From my perspective, I think that self-discipline simply means that you have to do what you are planning to do in respective to any, let's say, excuse. So I want to be, but at the end, we have to return back to what we planned in the SMART. So if your average is about 50, 60, and in the last 5 years, orthopedic surgeon, they are asking about 70 or 80. So it's not possible that you squeeze yourself that I want to be orthopedic surgeon, except that you are planning to do it outside, like let's say postgraduate study, and you have the resources for that. These are some examples of self-discipline, which is actually I applied in my life. One of them, this presentation, because I finished it in the morning actually, after preparing all these slides. Second, start today. It's impossible that you say that I will start next week. I will start by the start of the month or the year. But I recommend that start from today. When you close this webinar, start to think and make a brainstorming with your let's say others, in order to start your journey. So don't postpone your goal anymore. Take a risk. This is, you can't imagine that's how it's applicable, especially in our community. So when I decided to leave the government hospital after my graduation from board in 2016, I was unknown actually. No one know me, newly graduated. So how can I open my clinic? How can I start to let's say market myself as a doctor? And my interest and specialty is a spine surgeon, which is unusual to be let's say recommended by young surgeon. As we know that most of the spine surgeon, they are too old to in their practice in order to start. So but I took the risk, and I left the government hospital, and I started doing my practice by building my own let's say brand. Think out of the box. This is again, I think that's most of you, they have this idea because the new generation, they are smart. They expose themselves to many outside resources. Not, they are not like me actually. When I graduated from my medical school, I have nothing actually, no resources, no traveling, no anything. It was in 2003. So I'm struggling to choosing the next step till from 2004 to 2010. I got my first course outside. It was in Jordan. So I spent 7 years, while some of you, they already started to attend the courses outside or inside Iraq directly after their graduation. And invest in the long term. This is also important. So don't look for the short way, because if you are planning to earn money in your in your career, it's an easy way, just dealing with some, sorry to say, it's some of the dirty business, paying a commission. You will have a good number of the surgery, or let's say you will have a busy clinic, but at the end of the day, it's not a long-term business, from my opinion. So measure your progression. This is again, it's important. So who am I right now, and what's my plan in the 5 years? There is one guy, he's a PhD in psychiatry, it's called Benjamin Hardy. He said that personality isn't permanent. So if you are planning to build your goal in the next 5 years, so start to change your personality in these 5 years in order to have you in the next 5 years. Don't compare yourself with the others, because still me, there are many guys who's doing surgery better than me or more busier than me. But from my opinion, I think that I am better than myself in the last year, and I have a system that's built by my own. I will show you today. That's how can I measure my progression in every year and compare myself with myself before. Show your work. This is a very important. This is one chapter from my book as a contributor in the author. Till now, I have 2 chapters, and we are planning with Mustafa to publish the third one. And I think it was a very nice experience. And I know some of you, they have this chance, and I admire that's how smart you, that's get the point, and you are in the medical school, and you have a very good experience in the research and books. Not like me, actually, I discovered it after 15 years of my graduation. So my average will determine my next step. So I think it's true in some way, but I waited for 3 years in my permanency till I get orthopedic, simply because they didn't open a door for orthopedic specialty at that time, and the seats are limited to, let's say, 7 or 10. Well, nowadays we are talking about more than, I think, 50 in Arabic and Iraqi board. So I think that's today the chance is much more higher than before. And again, you can't go in a city elsewhere to spend 1 or 2 years and return back after that. The idea that you will spend your life with the specialty that you like, not choosing it according to the, let's say, limited time, 1 or 2 years that you want to spend it in your with your family. Try it. You may not don't like it. This is very true, because I like emergency medicine. So that's when we were, let's say, a child, and they ask us, that's what do you want to be in the future? All of us, they say that's either pilot, police, and I don't know why actually, or lawyer, some guys. But we say that without testing it. So when we grow up and we become, all of us choose to be a doctor. So test whatever you want to be, whether you will discover whether you like it or not. Build an infrastructure knowledge. We are living in the era of that's the learning and the teaching resources are available everywhere. Till time, I'm using YouTube, which is amazing actually, and I'm reading every time whenever I have a time, and I prepare some slides to make a presentation whenever I have a time. Still, I'm let's say a small baby in the field of spine, and whenever I invited as a faculty, actually the only one who learned from this experience is me, because I try to choose a new topic and arrange digging in the literature and arrange a presentation in order to be presented. Test your knowledge. We have many resources when it's come to orthopedic. Sorry that I'm concentrated on orthopedic because the only specialty that I know. There are a website, amazing website called Orthopedic. They have tons of resources, and even you can measure your progression and test your, let's say, information by doing exam online. How to get training? This is again a dilemma nowadays, but from my opinion, that it's not, let's say, that we blame all the condition, the government hospital, the mentors, but I will tell you that my experience that I let's say it's very difficult for me to choose the right guy who can join my team. I'm struggling in the last 3 4 years, and I get one wonderful guy, and I think he's available online. Mukhallad, he joined me 1 year back, and now he's my right hand. Actually, he has a very good experience. Within 1 year, he attended more than 350 surgery in the spine, and he has the full knowledge about how to deal with the patient, diagnosis, and the others. But I hope that I find another guys who can join my team, because clinical attachment in my practice, it's a very good experience. You will attend more than 300 cases per year, which is, it's not an let's say bad number if you compare it with the other. And again, very advanced cases and surgery. You cannot imagine that. Let's say how can we operate. By the way, tomorrow I have a list of 5 cases. 2 of them, it's very complicated cases. Abroad training, this is again, don't say that I will train when I will be a specialist. I finished 4 of my fellowships when I was aboard the trainee. And when you will be a doctor with a specialist and you will stick to your clinic, it will be a very hard that you spend months in training and fellowship. So the big thing that I think that I did it in the right way, that I spent doing my fellowships before being a specialist, and it is applicable actually. MOH training, all we know that we have the Iraqi and Arabic board. They offer a wonderful training with some of many mentors. They are available all over the cities in Iraq and in many educational hospital in Baghdad and other cities. Online courses, I think that I did both of them, the AO Spine Diploma and ECC Learning Diploma. And I'm the first guy in Iraq who get this 2 type of diploma. Actually, it's an expensive program. For ECC Learning Diploma, it took for me more than 2 years to finish it. And you cannot imagine that's how, let's say, testy is it, and how it's add to me actually. And I'm proud that I'm the first guy in Iraq who gave this type of diploma. And face-to-face training, this is the picture of mine that's in one of the cadaver courses in Dubai as a faculty to attend endoscopic spine surgery. And also fellowship, this is me in Switzerland, in Zurich, in one of the of my fellowships in 2000, I think 21, just before COVID era. And also mentorship, I have very good guys who joined me as a mentorship program that I started in the beginning of the last year. And today I have 2 senior doctor. They get lots actually, and they train with me, attending some cases every day. How to build your CV? Again, I think that's if you have a look, or if you had a look on my CV, as I told you, I started with a simple Word file, or you can use even Google Doc, save it online, and start to fill the basic information and update it regularly whenever you attend online courses, events, and other. Put it and updated. And whenever you need it, just export as a PDF and send it to who wanted. And by the way, that's I published my CV on LinkedIn, and last year I got three let's say job offer from Gulf area, which is actually that's very good chance for some of other senior, but I'm not planning to work as employee again. Why orthopedic surgery? This is one of the core slides that I want to discuss with you. From my perspective, it is multidisciplinary. The orthopedic surgery actually it's almost about more than 10 specialties that including spine, pediatric, arthroplasty, sport medicine, trauma, deformity, congenital, pathology, hand, emergency, and elective, and many of the other subspecialties. You cannot imagine that spine right now they have more than 6, 7 specialties that including MIS, endoscope, degenerative trauma, tumor, deformity, and the other. And also it's an innovative. Every year we have new technology, new let's say innovation, including the implants, the instruments, robotic surgery, endoscopic spine surgery, navigations, and many of the others. So I think that although the other specialty they have, but I think that orthopedic and the spine is one of the top rated specialties in this field. Another important point that's if you are looking for training, that's compare these two pictures. Me joining and the three of my fellow joining me to do one surgery, and this ophthalmologist that doing the surgery by his own, including also the ENT. So if you are planning to choose the specialty, I think that choose the one that you can have a good experience and good exposure to the training. So if you are planning to go ophthalmologist or ENT, I think that's let's say you will have a difficulty in training the program compared with orthopedic general surgery and other field. And I think that's variety. See this picture, this MRI, which including what's called the spondylolisthesis at the level of the 4-5. So if you are a specialist and planning to do surgery, you can apply all these technique, which is almost 9 technique and more, for this type of one pathology. So it's not 1 + 1 = 2. So if you go with the conservative, it's okay. Surgery, interbody fusion, and other technique you will learn when you let's say enter this field. So this will give you a great opportunity that you can deal with such difficult cases and have a decision whenever you face it in the clinical or in the consultation room. Highly demand. Imagine that low back pain affect more than 600 million people in 2020, and by 2050 it will be more than 800 million. And in 2020 alone, more than 3 million trauma surgery. This is not including orthopedic, this is including the general surgery and other trauma surgery. And in 2017, more than 5 million spine surgery and 1.26 total knee, more than 1 million total hip, and more than 22 million orthopedic surgeries per year. So I think that's, if you compare, we don't have local data, but one of the busiest field in Iraq is orthopedic surgeon, except the aesthetic surgery that's nowadays they have become more popular. High chance of training, so it's not one-man show as I mentioned before. So the team consists of surgeons, senior doctor, fellow, nurse technician, C-arm guy, and physiotherapist. So you will have a great chance for training. And again, if you compare it with the income, I will not show you my annual income because it's let's say confidential from me, but I will show you some data from all over the world. The orthopedic in US is at the top, and see that's it's a 8-month demand surgeon in the specialties, and more than 52 active surgeons. They are younger than 55 because it's a hard work. So problematic again, yes, as I mentioned in the earlier slide, it's a problematic field, and see what's the average annual physician compensation. It's in the top, the orthopedic surgeon. So prepare yourself for such things. That's even in Iraq, it's a problematic field because especially when we are dealing with the emergency cases. Resources, I think that's we have tons, books, application, Notion. I will show you my Notion in the later on. Orthopedics, I mentioned it's an online platform for orthopedic surgeon arranged by American and now American Board of Surgeon guys, and now it's become certified and they have tons of resources that you can invest. AO reference, this is an application that give you let's say the problem from history to classification and management and give you your skill levels and the others, and you can invest in it. Online, I think that you are more active and more knowledgeable than me in dealing with in online courses, because in my life I attend more than 10 courses, seven or eight of them they are not orthopedic, they are in the, let's say, business and let's say digital marketing and other field. And YouTube again, it's my favorite one. And SS Seattle Science Foundation TV, it's a professional platform in the YouTube available free. You will have courses that started from a fellow to more complicated revision complication and deformity courses. Most frequent cases that I face it's depend where you are working. If in my clinic, back pain is the most, and because I'm let's say I'm seeing more than 90% of my cases as spine. Trauma again, deformity all over the body, not only in the spine. Osteoporosis, it's common. Osteoarthritis, it's common. So I think that's the pain, whether it's due to osteoarthritis, disc stenosis, trauma, tumor, anywhere, is the most frequent complaint that you will face it in orthopedic surgery. Before end, I think that's I will end up with 10 tips before leave. First of all, enjoy, and I miss the picture. Actually, I prepared it, but I forget to put it. Your family is a top priority. This is a very important. I learned from my senior, from my mentor, and I'm starting to do my best actually in order to invest my time. But I miss my dinner with my family because I have an online lecture right now. Have fun. This is a very important, because if you don't have fun, you will have a stress and you will burn out at the end of the day. And don't cheat, don't do harm. This is a very important, and although it's a fundamental and basic, but nowadays you cannot imagine how the market is going on and how the level of the malpractice. This is one of my patients that brought this labels to put it in my clinic. That's to express his experience with the surgery in the cervical spine. Don't rush, follow the principle. This is one of my the X-ray that I got just before 3 days in my clinic. They got it in one of the government hospital. See, imagine this type of X-ray and the type before that I mentioned this type. Compare the quality, quantity, the two, let's say when we trained in the medical school, they said that's two view, two joint, and to I don't know why, but imagine how it's going on in the government hospital because of the limited resources. And imagine yourself that you have a trauma guy with this type of X-ray, and you are on the top of the, let's say, in the emergency department. So what you will say that's to this patient, and when you are working in a private, you will have an MRI, CT, and full spine X-ray and other, let's say, resources. Leave your ego. This is very important. Still, as I told you, I'm in the beginning of my way. And don't say that's I am, because at the end, ego is one to the knowledge. If you have, let's say, high level of ego, you will lose not only your knowledge, your respect, but even your friends. Keep reading and improve your career, because I think that's every day you have to read. And when I become an specialist, I read more than what I did in my training. because I'm facing the surgery, I'm facing the cases every day. So I think it's must have. And another important point that sleep well, because the physical and mental impairment causing by one bad sleep draft those equivalent to the absence of food and exercise. And for the guy who are with us, that's imagine that's men who sleep 5 to 6 hours per night have a level of testosterone less than more than 10 years their senior. So your age at the 20, if you sleep less, you will have testosterone level at the 30. So keep it and enjoy in your life. Eat healthy. This is a very important, and because it's important, and its affect only not only our body, but even our mind and decision and our career. And finally, let's invest the time in exercise. This is my daughter. That's I brought her to one of my gym classes in order to build very good habits for her. So I think that's it's finished. We will open the Q&A. So if we will have a time, I will make a review for Notion, which is a great platform. I started to use it in the last 5 years. So guys, let's summarize the question and started to answer.
All right. Thank you, Dr. Ghazwan. You have been immensely helpful to us all. Now, if anyone has any questions, kindly leave it in the chat so we can start responding.
So if you don't have a question, that's mean you get the point.
We do have some questions here in the chat. Abdullah Mujbid, he asks, how do you start your research career as a pre-graduate medical student?
Actually, I started my research career when I was in my final year of the board. I was, as you mentioned in the introduction, I'm working with AO Group. They have a very good platform in research. So I attend one event in Dubai. It was in 2015, one research course, and after that we arranged a research course in Baghdad, followed by another course in Erbil. And after that, I went to US and spent 1 month in Seattle in Seattle Science Foundation. They offered me to join one research team, and at that time, I just answered that I don't have any idea. The mentor there, they told me that you will have just let's say try to let's say to get some knowledge. So I started to invest time with some online courses at that time, and I did my first publication, and then followed by let's say reviewer. I was elected in one of the let's say big journal in Spain. Again, I told them that I don't have any idea. They told me that you will have, and again I invest time and become a reviewer, and nowadays I'm a reviewer for more than 6-7 journal. So I think that if I keep myself inside Iraq with my colleagues, I will do nothing, because most of us, including the mentors, they don't have any knowledge and or any motivation to do research. Try to connect with other guys outside. Samer Al-Hozi did a great job actually in this field, and he's more senior and more active than me in this field. But again, if you now I have many groups all over the world. They are my friends, and we are doing a research collaboration with them. The critical point, that's try it. You are younger, and again try to invest your time in research. And personally, I need team actually that's who can know how to start, and I can help them. But if you compare yourself with the others outside, you will have a motivation to start this career.
Also, we have Murtada. He has his hand up, so you can go ahead and ask.
هلا دكتور، بخصوص انه ذكرت انه مهم الواحد يكون عنده منتر خلال مسيرتك، الواحد شلون يحصل المنتر يعني حتى يرشده بطريقة؟
شوف الفكره وما بيها انه انت يو هاف تو فايند ا منتور. يعني من قلنا بالبدايه انت يا اختصاص تريده. طبعا المنترز هو انواع. المنتر ممكن والدك يكون منتر، ممكن صديقك الكبير يكون منتر، ممكن واحد انت بعيد عنه اصلا يكون منتر. تعرف يعني انا اليكس فاكارو تقدرون تسرشون عنه. يعني ببساطه هو انا ما ملتقي به، بس هو المنتر مالتي يمكن 7 سنوات الى ان التقيت به. اكو منتر يعني استاذ داود العبيدي هو المنتر مالتي بالتريننج، تعرف. اكو منتر انا كنت اروح اتعنى له، احضر له ايفنتات حتى اشوفه موجود، حتى بس التقي به واشوفه. فانت من راح تختار الفيلد. زين، انت شنو الانترست مالتك؟ ريسيرش. اكو بيج جايز بالريسيرش، وما تتصور ايش قد همبل هم وسمبل. just send them an email and ask them anything. زين، they are willing to collaborate. زين، فالفكره اول شيء انت شنو نوع المنتور اللي تريده؟ هل هو in your life، لو in your field، زين، لو ريسيرش، لو اي شيء. وتراي تو find out. زين، وكونتاكت them. بس الايديا ذات يو هاف تو هاف ا بلان. تعرف يعني انا من التقيت بفاكارو كان بنيويورك. سمبلي قال لي انت شو تريد؟ هيك يعني. قلت له انا ما اريد تعلمني انت في التكنيك سيرجري بيكوز يعني سمبلي يعني انا اقدر اتعلمها يعني بغير مكان. اريدك تعلمني كيف اكون يعني جود ان ذا فيلد اوف ريسيرش. قال لي هو هذا الشيء اللي انا انتظره من عندك، لان انا بالنسبه لي تكنيك انت تروح تتعلمها افري وير، بس السكيلز بالريسيرش انت تقدر تتعلمها. وبديت وياه بهالموضوع هذا. المنتور شيب تقريبا طولت 6 شهور، هو لحد الان ان كونتاكت وذ مي. الفكره انه قلت لك انا من اروح ايفنتات، اذا انت رايح على العلم فقط صدقني تقدر تحصل هذا العلم موجود اونلاين وفري. بس انا من اروح اعمل كونكشن، سوشيال كونكشنز، التقي بناس، اخذ كونتاكت ديتيلز، اسوي فولو اب لناس انا اعرفهم، اروح ازورهم. زين، واعمل مينتنس لهاي الريليشنز، لان انت راح تستفاد من عندهم. يعني تصور انه انا هسه مثلا من عندي سباين تيومر كيس، ادزها البرياني. برياني هو نمبر 1 بالعالم بالسباين تيومر. زين، هذا التقيت به. والاخ ادز الديفورميتي، ادز الشخص يعني ask them about their opinion. فكل فيلد انا عندي منتور، كل ما يمر الوقت اعمل مينتنس لهاي الريليشن شيب، لان بالنهايه انت راح تستفاد من عندها. زين، المنتاليتي والطريقه اللي يفكرون بها تختلف جذريا عن اللي عندنا. انا احكي لك على الفيلد مالتي انا يعني، بس still you can have your local mentor. زين in Iraq يعني. It's depend on you.
شكرا دكتور.
Okay, Dictor, also, Shams Salam, she had 2 questions, and actually one of them I wanted to personally ask her as well. She was asking about, you mentioned earlier that we have to devote some time into our family aside from work. So we wanted to ask you from an honest and personal perspective. Sometimes it's really not in our hands if we can devote this time into both genres of our life. So from your perspective, were you able to devote time to your work and to yourself simultaneously?
If I want to answer this question, I have to be in a room that's my wife didn't listen to me. It's an almost difficult, actually, not impossible. But when I start to leave the government, I have an extra time, and when I have a planned goal, let's say from I have a plan in my notion from the beginning of the year. So I want to earn X money and I want to do X number of cases. This will give me a confidence that's not hurry up all over the day. So if I'm planning to do 200 cases, so 200 cases per month, it will be about 15, 18. So I will start my month. If I earn this 18 or 20 cases, so it will be fine. So I will be more relaxing to spend the time with my family. And again, I'm not doing emergency cases. So simply when I have an elective cases, I can schedule them for surgery. And whenever I traveling, I took my family with me, so it will be a very good, nice time that we spend, let's say, time together. So If I compare myself with the others, might be I'm not let's say on the top of the guy who have a very good time with their family, but life is balance. So I have to have my own goal, my own future, my own cases, patience in addition to the family. With time, I started to grow up this idea, and and I had more and more time and concern about this issue.
Okay, next question is it's from also Shams. She's saying, of course, you know, there's a lot of physical strength needed in the orthopedic specialty. There's also mental strength needed. So that already causes, you know, a little bit of discrimination between whether a male or a female could be an orthopedic surgeon. So she was asking if there are any orthopedic surgeons who have been successful in Iraq.
You know, actually, we had one specialist, Dr. Zainab from Erbil, and nowadays I think that we have many female permanent in orthopedic. Needing physical, let's say, strength, it's a myth actually, because nowadays many field in orthopedic you can do it even if you are, let's say, 30 kilo weight. Pediatric orthopedic, minimal invasive, hand surgery, ankle and foot, sport medicine, all of the spine all over. You don't need any physical strength. Except, let's say, hip dislocation, knee dislocation, might be arthroplasty actually in total hip, but you are not the man, you will do everything. So I think that's, yes, you can do it, and you can build your career. And I attend many fellowship and clinical attachment outside. We have many of the orthopedic, let's say, girls doing, and even in the global spine, which is the let's say the AO Foundation, they have a special session for women in the spine, and it's not a limitation from my perspective.
Okay, well, also Mustafa Saadun, he's been raising his hand, so you go ahead and drop your question.
Yes, hello, doctor.
Hello.
Thank you for an amazing lecture. Very informative, very insightful. My question is, thinking outside the box, as you said, how would you go about thinking outside the box as a surgeon nowadays? How would you distinguish yourself in thinking outside the box in creative new ways? How would you go about it? Just that. Thank you.
Let's start it with my, let's say, option that I had in 2018. You know, every year I put a goal again, how many income, how many surgeries, and I increase it every year 10 to 20% from my previous year. So next thing, I will have a question, that's what make me to do more surgery than this year, the year before, and having more time with my family. Because, you know, I had, let's say, I started my career doing 6-day clinic, and nowadays I'm doing 5 days clinic. And my plan in the next 2 years is to do 4-day clinics, and then after that 3-day clinics. So I'm increasing my income, increasing my number of surgery, and decreasing my presence as in the clinic and the surgery. So I have to think outside the box. I have to invent a new technique, which is not available in Iraq, that's attract the patient to come and choose me. This is as simple as, I will ask me again myself, that's what's the new innovation in the spine surgery is to be invested. In 2018, I had a choice at that time is to choose between spine tumor fellowship with Buriani. He's, as I told you, is #1 right now in Italy. Is to invest in the spine tumor and become #1 in Iraq as a spine tumor guy, or to choose the endoscopic spine. Simply, I had a negotiation with Buriani. He told me that the minimum, let's say, fellowship for me is 1 year. So I told him it's impossible for me 1 year. we decreased it to 3 months. And again, he just asked me one question: are you working in a government or private? I told him private. So he told me, let's leave this job. I told him why. He told me that simply I'm in Italy and I couldn't invest in a private for a spine tumor because it's a complicated field that need lots of infrastructure. Again, let's say at that time I had to choose, let's say, a new technique, which is, let's say, profitable and sexy and let's say new. That's why I started to think about endoscope. Directly after that, I traveled to Korea and did my first fellowship there in the endoscopic spine surgery. And after that, I returned back to do endoscopic spine surgery. And then after that, my career in the field of the endoscope started to increase by broadening the indications from disc to stenosis to fusion, and increasing the number of cases, publication, and others at that time. So how did I do at that time to thinking about outside the box? So if I'm thinking inside the box, so okay, I'm a senior doctor, my salary is about 2 million. I had 2, 3, 4 cases from emergency from the government hospital, like my friends. I have my own apartments, my own car, so it's okay for me. Why I have to think and invest? You know, I invest more than $60,000 just in buying and purchasing the system of the endoscope. And by the way, I think Mukhalad even know that almost 90% of the implant that I'm using in my practice, it's my own investment, because we don't have let's say a local good reps and the companies that can invest and bring this new technology, because they don't believe it and they don't believe in yourself in the beginning. So I'm smart enough that I want to invest. So I took the risk to go to Korea, and then took a risk to invest money in this new technique and thinking outside the box. And nowadays, this year, I had more than, I think, 90 to 100 cases of endoscopic spine just this year.
So basically, sir, it's risk versus benefit, and you kept challenging yourself, new ways in your specialty and new technologies, and you continued to bring new things every 3 years or so, as you said.
Yes.
And basically that, right, sir?
The idea, simple idea, thinking outside the box is thinking in the way that your friend is not thinking in this way. Simply.
Yes, in a different way.
In a different way, yes. And when you think of in the different way, you will have more risk and you will have, let's say, more effort. This is the idea.
Okay. Okay. Thank you, sir. Thank you for amazing lecture.
There's just another question. This person was asking about building a name and brand in business, and how it is harsh to stand out now with all the busyness of like the Harthia. It's packed with very professional and successful doctors. So how do you build the business and to grow your name and your own identity in between all that crowd?
Myself or himself?
Himself, I'm sure, or us, us young doctors who are on the way to shine, compared with the old ones that people prefer.
We still have a deficiency in the surgeons and the doctor in Iraq. And let's say the field is open to any guy who has, let's say, a unique and bring a niche market, as I told you in the beginning. There are many guys in other fields that are successful in their field and they are young. So I'm not a successful guy at the end, but we have in the plastic, in the general surgery, in the gynecology and other each specialties. If you're thinking about it, you will have a deficiency. You will figuring out the deficiency and try to invest. This is the idea. So if you are planning to do, let's say, general surgery, so what's the trendy right now outside, and try to check it if it's available inside the Iraq or not. So if it's not available, try to, let's say, go further for the next step and invest time, effort, might be money, let's say, going there, to see what's going on in order to be one of the let's say professional guy in that field. Still in the orthopedic spine, there are lots of deficiency because in the let's say in the endoscopic spine when we are talking now we are about 3 or 4, so we have to have at least 100 guy who is doing endoscopic spine in order to change the mind of the people and let's say doing the endoscopic spine as a
We have some more questions if you have the time. Someone was asking about your opinion on plastic surgery, reconstructive surgery, and aesthetic surgery, all in general.
My question I think will be biased. I don't believe in aesthetic surgery. I believe in a plastic and reconstructive surgery because I think that's aesthetic surgery in Iraq. I'm talking, it's a short-term business, problematic. And, the idea that there is no parameter for success. So, when a patient need, let's say injection of fat or something, I don't know, so you think that you did this job in right way, but from her or his perspective is not a good way, so many of the let's say problem rising up again. It's let's say it's underestimated by the technique. If you enter to the surgeries, you will see that the basic antiseptic protocol is not applied. So I don't like the aesthetic actually, but I like the plastic and reconstructive, and it's amazing branch actually. And unfortunately, that's most of the plastic surgeons, they are shifted to aesthetic surgery. Might be from the demand, but I think that still the plastic is a very good branch that you can invest if you have opportunity to choose it and work on it.
One student was asking if you could give out the names of the people you mentioned in the research field earlier. They were asking for those names. If you could do that.
One of them, let's say I can, Alexander Vaccaro, Jens Chapman, Massimo Tanaka, I think. They are available in my LinkedIn and in my social media. I can't just, let's say, highlight them or mention them. Most of them, they are, let's say, my friend on the social media. They like to choose, some of them, they like to choose, to use actually the social media. Tanaka, this guy, Masato. He's from Japan, and he's amazing guy in the, let's say, in the research. But the problem that he's doing his surgery in one of hospital that they have everything, which make me actually not interesting to go to his center, because his center has a navigation robotic, which is not applicable in our country when I will be back. So he's a good friend of mine. These are some guys, and there are for sure many guys. In the 6th of April, there will be one research meeting about the meta-analysis in Dubai. There are two expert guys who will come to arrange, and now I'm in negotiation in order to open this course as online. So I think that if we will open it as online, there will be a very good chance for you in order to expose yourself to how to do a meta-analysis.
Doctor, may I ask where Dr. Tanaka has is his residency? Has he ever been in the US?
The first two guys, they are from US. One is working in Philadelphia, Alexander Vaccaro and Rothman Institute, And Jan Chapman, he's originally from Germany and he's working in Seattle Science Foundation. Massimo, I think that he got some training in US, but he's currently in Japan. He's doing his, let's say, his training. And by the way, next week we will have one event in Karbala. We will invite one of the big guy in the minimal invasive spine surgery in the world. It's called Ervand Kulgari, I think his name like that. He's from India. He will be in Karbala for one event about degenerative and trauma surgery in spine.
Doctor, one student was asking whether you give out lectures and how they could attend these lectures, if that's possible.
As I told you, I will be in person for this course, and I am in negotiation for opening this course as an online. So I will inform you when we get a permission, because it's a paid course and under the regulation of AO. So we try to push the AO in order to open. But by the way, if you join the AO, there are tons of resources, especially the AO, what's called AO peer. I will send you the link. This is the AO platform for research. They have very good resources in the term of research. You can't just go there and explore let's say the resources that's available. This is the link that's you will have it. They have the AO Foundation, the AO Peer. They have good resources for the research, so that you can explore it. And even I have some courses which is recorded, so I can share it with you. But I think that's the resources that's available for this for AO Peer. It's very rich, and you can let's say explore it.
Mustafa Saadion has been raising his hand. So.
Yes, hello. Sorry for persisting, doctor, but I have
Mustafa,
continuation to my yes.
be the guy who asks lots of questions. You know, whenever I traveling to any event, they told me that's the Iraqi doctor asked lots of questions. You know, this
Yes.
is a very important point.
Yes, thank you, doctor. To continuation to my question about the niche and the out-of-the-box thinking, in Iraq, I think there is a lack of prosthetics and prosthetic limbs in general, like good quality prosthetic limbs, as you mentioned in your lecture. So how would you go about providing such a service in our country, even though it's a poor country and not many people are capable financially? How would you go about that?
You know, Marwan, Mustafa, the idea that we are a poor country from inside and an oil-rich company from outside. When I was in the States, I met many guys who's doing a charity work in Africa, and I invite them just come to Iraq to do some charity work, doing surgery, inviting the companies, and they start to laugh on me that simply you are from a rich country. This is a controversy that we are living actually, but as I told you, I invest lots in the implants and the technology, and you cannot imagine that's how what's the number of dollars that I had. And I'm facing that every day, poor people coming to me asking to do, let's say, such fancy updated surgery. And simply I told them, let's go to the government hospital. Or it's okay for me from one time to another to have a surgeon fees free surgery. But it's not logic that to spend, let's say, all the patient doing cheap surgery, because if anyone looking for the cheap surgery, it's not my clinic. I'm because every year I invest more than 20 to $30,000 just for traveling and courses. And before 2 years, it was more than 40,000 actually. So if I'm working in the let's say for the poor company, for the poor people, and paying all the expenses of the surgery, at the end I will not have a money that's able to eat by the end of the day. So my reply to these people that you can attend the government hospital, they have huge resources. Whether they do endoscopic or advanced surgery, I don't know. But the government spend lots of money on them. And some of them, they regard themselves as an expert. So try to contact them. I'm working on the 1% of the people who has money and willing to get a good, let's say, good service at the end. So for the implant that you are talking about, prosthesis implant, it's a costly, and in the same way, imagine how many people who lost their leg and they have
Of
a money,
course.
and they have a money actually. Most of them they don't have money. So one of the let's say a bad corruption thing that's they invited one guy from Australia, originally from Iraq, and he did lots of money actually. You cannot imagine, up to millions of dollars in his prosthesis, which is actually, it's not let's say verified or recommended till now. So I want to keep myself away from this issue, and because I'm working totally outside the government hospital, I offer my service to the people who want to pay for advanced options, and for the people for the poor people, they can attend the government hospital, which is more than, I think, 100 hospital all over the Iraq. They are doing spine surgery and arthroplasty and other options.
Thank you, doctor. Very, very well, and very good answer and very informative. Thank you.
Welcome.
We have this question here, and it was someone asking whether limb transplantation is occurring and being conducted in Iraq or not.
Actually, I don't have idea, but it's they can check with I think with the medical hospital and the others. The problem again, when I asked to train for the spinal tumor, I left it because it's required a huge system and team. So I think that liver transplant, again, it's required a huge investment. Try to invest in something that's you will own the market, that right now, let's say for the endoscopic spine, I have my set, which is I can put it in one small bag and traveling everywhere to do the surgery. But if you are planning to do liver transplant, so is it feasible that you can do it in any hospital? It's not. You will need another key persons that's working on the compatibility, let's say GIT surgeon, GIT doctor, histopathology, and others. So it's not logic for me. I want to work on the field that I will own this market. I will be a decision maker that can do such surgery. I was in Pakistan two weeks ago, and I did one endoscopic spine surgery, even without instrument they have for endoscopic spine surgery. So if I am a liver transplant guy, so I'm traveling to any hospital elsewhere and trying to do one liver transplant, how much time, effort, resources that I will need. So at the end, I will not able to do such surgery. So I think that's whenever you think about it, you try to, as we mentioned earlier in the lecture, you have to collect the data, resources, test it, whether it is feasible or not, why the other people, they didn't invest in it yet. So if you will have a good answer and a clear answer, I think it's okay for you.